How do I identify abnormal? One of the key functions of the pathologist is to identify abnormalities, or when things go wrong in a specimen. In hematopathology, things can go wrong in many different ways. Nevertheless, the most basic concept is that there is too much of something, either from too much proliferation, too little destruction, or maturation defects. The thing is, in the peripheral blood, you already have billions and billions of neutrophils, there are billions and billions of red cells, and you have billions and billions of lymphocytes and platelets. How do we know that it's an abnormal proliferation of these things versus the normal millions and billions that we have already? One way we know is to look at the expression or presence of proteins on the surface of the cells. Most of those proteins go by the name cluster of differentiation, or CD markers, which are frequently proteins. CD1A, CD2, CD3, CD20, CD45, and many others. We look at and analyze the pattern of expression. Abnormal or aberrant expression can be an extra unexpected protein, gain, or lack of an expected protein, loss. When the pattern is unexpected, we can tell that the cells are abnormal and will say they have an abnormal immunophenotype. Another way that we can identify abnormal is if we can prove there is one particular clone, monoclonal, or one family line that is proliferating as compared to the normal finding of lots of different clones, polyclonal. A monoclonal finding is also called clonality. When we see that there's only one clone, then that's another marker of abnormality. There are many ways to evaluate for clonality, and we often use more than one method, just to be sure. A third thing we can look for is if it seems to be doing bad things. This is proliferating so much that it's compromising the body's normal function in some other way. For example, the normal white cell count of 6 to 12,000 per microliter jumps to 230,000 per microliter, and there's decreased blood flow to vital organs. Or in a lymph node, instead of having a normal less than 1 centimeter diameter lymph node, there is a giant 10 centimeter mass. These are doing bad things. Clinically, it's causing problems. So those are the three main features that we look for when it comes to more mature forms. Again, they are abnormal phenotype, clonality, and doing bad things. We need all three in order to confidently diagnose a HEMEpath malignancy. One additional thing we can look for is lack of maturation. Lack of maturation can be considered another type of abnormal phenotype, since the cells as a group are not showing normal protein expression. The myeloid progenitors, myeloblasts, are supposed to mature into neutrophils, eosinophils, and basophils. However, when there is a maturation roadblock and there are too many of the early forms, we know that that's a bad thing. A complete lack of maturation on the myeloid side is called acute myeloid leukemia, AML. There are a ton of these cells proliferating, and they're not maturing into the more mature forms that our bodies use to fight off infection. On the lymphoid side, the same thing can happen. There can be too many lymphoid progenitors that fail to mature, and we call that acute lymphoblastic leukemia, ALL. Most of the time, they'll show some B-cell markers or T-cell markers, but still, they show an immunophenotype or protein profile more in line with early precursors, and they're not progressing into the more mature forms. We'll cover the naming conventions in more detail in the next chapter. During the course of your HEMEpath rotations, you will build upon this foundation to acquire knowledge of the many abnormal phenotypes and what diseases they are associated with. You will learn the abnormal clonal features associated with each disease entity. And you will recognize the clinical complications / bad things that the various diseases can cause.